All right, Spencer, welcome back. Last
Well,
month in healthcare. It's been a while.
thanks for having me, Nathaniel. I
Yeah, it's
appreciate it.
my show.
Yeah.
Last month in healthcare. So last month in healthcare, I'm producer Nathaniel for Spencer's podcast, Self Funded with Spencer. Spencer's an expert in self funding. This is the show where we go over the news, review the podcasts, do a game.
And who
It's pretty
knows what
chill.
else, because you just come up with
Yeah.
surprises every week or
Yeah.
every month. So it's cool. Let's do it, man.
All right, let's hop into the first news article. Senators propose bill to ban prescription drug ads. This is something you've talked about on your show a lot. I think an episode this week you were talking about this.
Yeah, that's
we were
true.
just recording. But so in 2024, the 10 largest drug companies made over $100 billion in profit and spent more than $5 billion on TV ads. And it's 30% of major primetime advertising, which I can attest to because I'll watch sports games, NBA games, NASCAR, whatever. It is every commercial
It's literally
break.
every commercial break. And you've seen those like Joe Rogan montages where it's like brought to you by Pfizer.
Yep.
And yeah, it's just constant. If I'm not mistaken, though, I don't know when this article headline came from, but I think they actually did either veto the bill or vote it
Really?
down. Yeah. So
Okay.
people have to fact check me, but my understanding is there's only two countries in the entire world that allow direct-to-consumer advertising for pharmaceuticals, and it's the U.S. and New Zealand, if I'm not mistaken. And I'm also not surprised that if I am correct that it got voted down, because you can see the money on the screen, the amount of money that's made as well as the amount of money spent, and for them it's obvious how
Crazy with this is how do you make an argument as a senator to be like we shouldn't ban it? You know what I mean? Obviously it's because I'm sure they get lobbied or whatever, but like what argument is there to be like actually people want? I mean, maybe the argument is the TV networks are like we would go out of business. I don't know.
I actually think that's a big part of it. I think the advertising money that comes in from them is so vast that they're dependent on it at this point. So you have a lot of healthcare lobbying. I think I saw Chris Hamilton recently talk about on a podcast that the pharmaceutical industry spends 2.5 times as much as the military, and there's another really big one. They spend more in lobbying than these two other ones combined, 2.5 times more.
Yeah.
So there's just so much money in the lobbying, whether it's right or wrong or indifferent. I think most people think it's probably having a ton of influence on the industry as well as in healthcare at large. And you'll have doctors say, they get hounded all the time, obviously, by pharmacy reps and whatnot, but I don't think doctors even know what they're prescribing and how expensive. And people will just come and ask by name for some $100,000 drug, Skyrizi, because they saw it on a commercial.
Yeah.
It's really like a bizarro world that we live in.
So next one, a bit also, I guess that one was kind of a downer since I guess the bill got killed. This one's a bit of a downer too. The one after this is more upbeat, so stay tuned. But this one is 33% of Americans between 12 and 17 are pre-diabetic, according to the CDC. Is actually from 2023, so those numbers might be higher at this point. I just for context, I'm born in 2000, so I chose numbers from 2000. Okay. But in 2000, the pre-diabetes rate for children was 11.6. Currently, 38% of adults are pre-diabetic, and in 2000, that was 22.
Yeah, the more concerning of the two, although obviously the adult is concerning, it's tripled in prevalence in the last 23 years. That's in kids, right? I mean, kids are resilient. My children eat a lot of sugar and chips.
That's what's crazy. Is like your insulin resistance or whatever. It's supposed to be good when you're a kid. That's all you eat is.
I would
agree,
but I don't know what all this is coming from other than the processed food. And of course, we do our best, but we struggle to get our kids to eat the stuff we want. And people can give me parenting advice and say you shouldn't have it available, and I agree with all that. But I also wonder if some of this is just awareness. The proliferation of glucose monitors and stuff, or maybe we're being more proactive in checking. So it's possible. I mean, the fact that it's pre-diabetic and not diabetic means we're recognizing it earlier symptoms. So perhaps we're stopping it from happening, but it's still a concerning trend.
And I mean, honestly, part of what you were just saying with the parenting thing, I do feel like there's somewhat of an epidemic. I feel like I see, at least, obviously not a ton of my friends are parents yet and stuff, but I see it from people older than me. Of a lot of parents, I feel like don't know how to say no to their kid.
Yeah.
So the kid's just like, I want to drink Coke and do whatever. Like they just are like, whatever, because the kid's gonna yell or whatever. Like just give the thing to them.
The giving in is the hardest part as a parent, because sometimes the giving in is just to get them to be quiet so you get peace. Yeah. But here's something we do. We're not perfect, but we have convinced our children that the flavored waters, sparkling waters, we call them Cokes. Because Mimi, mother-in-law, she drinks a lot of Coke, real Coca-Cola. And so we're like, oh yeah, you can grab a Coke and then it'll be a sparkling water with no sugar at all. So they actually know when they have a Coca-Cola or a Dr. Pepper that it's a separate thing and is a treat, but we've not given them the sodas. So therefore they don't have the habit of drinking.
Like when I was a kid, the thing was always no soda in the house. Like my parents wouldn't buy it or anything. It was always just, if we went out to eat, I could have a soda. That's it.
That's essentially, so at dinner or something out, might get a Dr. Pepper or a Sprite. But it's not every day and it's not every morning asking for it.
So healthcare workers are leaking patient data through AI tools. This is by a cybersecurity company called Netscope. They did a study that 71% of healthcare workers today in 2025 are using personal AI accounts for work. So that would entail, a patient has this symptom list. I'm going to plug those symptoms into Google Gemini, ChatGPT, and ask what it is. So,
well, I can't speak to what everybody else is doing. I know we have a closed instance, at least our organization does, of ChatGPT. I rarely actually use it, but we are not allowed to put obviously any PHI into an open source network. I'm not surprised though, because there's no barrier to entry, right? You think I'll log on to ChatGPT and put it in, and you don't think about the HIPAA concerns of doing that.
And I bet a lot of those people think it's like, oh, I'm not putting their name in. I'm not putting, but it still is. I don't know. It's a weird fine line there.
I mean, we're going to see a lot of more of these type of things emerge in compliance regulations. I mean, I just had to go through compliance training of all these things. I'm sure you're going to see a lot of emphasis on what goes into any sort of open source AI. You have to expect it's out there. It's just, somebody can have access to
Especially Google and ChatGPT.
I
mean, that's the
no-brainer.
right way would be like something you said where it's like you have a local instance of it. It's not connected to the internet. And
it's proprietary to your organization, right? But I'm sure you could argue, and I'm sure our security and IT team has vetted it, but even if you have a closed instance, it's still obviously got risk associated with it. So I'm sure they have all sorts of other cybersecurity around it.
So next, we're talking about my good friend, Mark Cuban.
Yeah, you met him.
I filmed with Mark Cuban a couple weeks ago, so he's my good friend. But
who hooked you up with that?
Spencer through Brown and Brown. So
thanks.
Shout out to Brown and Brown. Shout out to Spencer. So somebody tweeted at Mark Cuban and said, if you were in charge of the U.S. healthcare system, what would be the first 2 things that you would do on day 1? And I have his answer here. And I just thought it'd be fun to talk through and review. So he said, off the top of his head, allow patients to pick whichever cash provider that honors their published price, have them commit to what they can afford to pay, and taxpayers finance what they can't, with repayment being deducted from their paychecks, but limited to no more than 10% of their check. There'd be 0 premiums to insurance companies, but you pay $400 to $500 a month for your family for reinsurance, capped at $50K. So you never incur more than that in annual medical expenses, no PBMs, no healthcare from employers. You could buy private insurance if you wanted to. Medicare and Medicaid would go net pricing on meds, and fee for service for needed services like claims processing and other required services. So he said numbers are just guesses, et cetera. It's just an idea. But
so it's probably hard to unpack this whole thing right here, but cash pay, that's going to be an obvious thing in the future. And cash pay could mean through the employer supporting the employee with cash pay. I definitely like the idea of publishing prices. No insurance companies, no premium to insurance companies. So he wants to untether insurance from the employer.
And it's not really, I feel like it's not really clear where that $400 to $500 a month, I guess it's for reinsurance, but I don't know reinsurance through what.
Give him some credit. He's spitballing off the cuff. But what he's essentially talking about is your own stop loss policy is the way I read that. Paying $400 to $500 a month, capping at 50 grand. I like the way he thinks. Everything he's trying to do is blow up the existing system. So not even
cut out the middleman.
Cut off middleman.
Simple as possible.
But you still need something behind the scenes to back and support or pay for very large catastrophic claims. So private insurance, government risk pool of some sort. The reality is, and we just talked about this with Jay Ritchie today, the enormous price tag on some of these claims. If you don't have a backstop for that, cash pay is great, but if you have a premature baby that's in the NICU for 60 days, who's absorbing that risk? I don't know the answer to that. Well, Mark, if you're listening, help us understand this and come
also,
on the podcast.
Anybody in the audience, connect us with Mark Cuban so we can come on the show. Tell Mark Cuban, tweet at Mark Cuban and say, go on Cell Phone with Spencer.
But he's obviously spoken at one of our events before. He is a disruptor by nature, and he's got obviously a big name. He's got a lot of money. He's got influence. So if I were to bet on any one individual to really disrupt pieces of the healthcare system, I think he has a chance.
It's been cool to see him. He tweets a lot about it. I feel like I see him.
He's become
post about
like
it
obsessed with healthcare, which is kind of cool.
Yeah. This is our last article. It's not really an article, but just a photo I saw online.
I saw this. Yeah.
Okay. Yeah.
No, I didn't see you do it, but I did see this on Instagram, I think.
So in 1990, it's just showing United States in 1990 to 2024. So what is that? 34 years. But showing the top employer in each state. And back then it was manufacturing, retail, hospitality, and public administration. And now it's manufacturing, retail, hospitality, but a lot of states are healthcare.
I'm trying to count the states. So 1, 2, 3, 4, 5.
I mean, it's the majority
6,
of states
7, 8,
up there.
9,
Healthcare.
10, 11. I only count 11. No, 12 if you count Hawaii. So only 12 of the 50 states, healthcare is not the primary industry.
Yeah.
So healthcare in 38 of the states is. I would say that was crazy, but I also don't think that's surprising whatsoever. Obviously, I don't know exactly what they're putting into the healthcare bucket. Right. So on one hand, I think, hey, good for those of us that are in it.
Yeah.
On the other hand, I really worry about the long-term implications of this for the country.
Yeah, it's also one of those things of like, because I would assume it lumps together healthcare, like, doctors and things like that, and then also the health insurance that backside of it, right?
Yeah, healthcare is everything from delivery, insurance, products, hospital systems in and of themselves. Yeah, all of that. So it's not surprising if we know that.
It's kind of crazy, even though it's the top employer. Don't we still have shortages of nurses and things like that, like all the time?
I mean, there's companies that their sole job is to place traveling nurses.
Yeah.
So that is my understanding, yes, because you've got an aging population. We're living longer than I think was anticipated originally, with Medicare and Medicaid and things like that. You have, of course, the money that's in this industry. Yeah. So if it's I think it's 18% of GDP. It's not surprising that 18% of the GDP means most states, this is the dominant industry as well. Oh man, I'm scared about the lack of manufacturing in the
shifted
US.
From a manufacturing country
we don't
to a
make
healthcare country.
Yeah. That's more important than whether healthcare is a dominant industry. I think more important is we need to shift back manufacturing onshore. I know that's outside of my realm of expertise, but I think America is a country that builds. In the last couple of decades, we've offshored so much manufacturing. I would love to see us reshore a lot of that stuff, have AI and all the cool things and lithium mining and everything onshore, so that we become like a net exporter of a lot of the energy stuff as well. Make cars here again. I mean, I'd love all that stuff to come back.
So if you want to hop into the self-funded review, we'll talk about the, so this section for people who don't know is we'll talk about all the podcasts that have recently released. I think I have 5 on this one.
Okay.
Start with, I'll play the clip. This is Rob Gelb. We filmed this in Philadelphia.
Okay.
So
why don't we leverage what we've built and create an optimized opportunity for a health plan of the future? So Valens One is going to be our fully integrated opportunity for you to use stop loss, all of our rewards and member engagement experience tools, leverage our contracted and non-contracted network design, leverage all of our cost containment clinical solutions, and allow us the opportunity to help you create a better member experience for the right self-funded, self-insured employer.
Cool. Well, first, shout out to Valens as a sponsor of the show.
Yeah.
So thank you, Rob Gelb. He was obviously instrumental in that. This one was cool. Those of you who haven't seen it yet, we got to go to Philadelphia, technically Conshohocken, PA, and
my
shoot
hometown.
Your hometown?
Not really my hometown, but I grew up in rural Pennsylvania, but I lived in Philly for a number of years.
And I'd never been to Conshohocken before. It was a cool town. You got you some cheesesteak, which you got excited about. But Rob was gracious enough to spend basically half a day with us, let us shoot in the home office of Valens as well, even do an episode of the Last Month in Healthcare too, which is a lot of fun with him. And so special thanks to Rob. And if you guys haven't checked out that episode, definitely do.
And it was cool that he kind of debuted the Valens One.
He did,
solution on there.
We had to hold off and get the timing right. Yeah, it was kind of cool. What does functional medicine mean versus our traditional care?
The core of it is finding and treating the root cause to reverse disease and optimize body function, which is where the function comes from. We do things like more advanced blood panels, hormone panels, gut health testing, so we can really put the picture together for people and figure out what's been driving their symptoms.
Yeah, I love that. That was a fun episode. it kind of feels a little bit off the beaten path for us, but it wasn't. And the whole point was like introduce this idea of functional medicine, but deployable in the employer space. I actually got a lot of feedback messages afterwards where people are like, oh my God, like I didn't realize you could do this. I want to learn more. Can you connect me with Erica? I think if there's 2 or 3 people specifically I connected her with, because they thought that was a great episode too.
So I always say as a broker, it's a cool part of the job, but also kind of sad at the same time, is our job's counting cards against the system. Because everything catches up 5 to 10 years later. The market, like every other broker, every other consultant gets in like, oh, that's a great idea, we should do it. And we're always trying to find the next little thing, and then the system eventually shuts it down because it messes with somebody's money.
Yeah, he's that was a personal favorite of mine. Yep. And I think as much as Erica got kind of inbound interest to the curiosity, his episode did really well, because I think what I've discovered with our audience is they want to hear from other consultants. It's a lot of consultants listening. So anytime we have a consultant on, they want to hear what another consultant's doing. Right. And Taylor's obviously one of the best. He was connected to me by my colleague, Steve Hansen. So shout out to Steve for the connection. And Cottingham Butler does do some business with us. But it was more a personal treat to get a chance to sit down and pick his brain.
Yeah.
Good job on the clip, by the way, the tobacco clip where he introduced the idea that actually smokers are cool. Less expensive on average during their working years than non-smokers, which was completely opposite of what I thought was true.
Yeah.
We're trying to bring a really simple solution to a really complicated problem. Give every American a trusted, independent health and medical partner who's there for everything they need for the rest of their life.
I like the value proposition of Amaze a lot. So this is the CEO of Amaze Healthcare. And their whole thing is like train people to call us first for any healthcare interaction. Let us screen and triage and have clinicians on staff to direct the people wherever they need to go, whether it's the sniffles to a broken leg or anything in between. And I think as our world of self-funded healthcare expands with point solutions, my thought process is we're going to come back the other way, reduce the number of those solutions that are available. And Amaze is kind of that example of they put a bunch of things back together to simplify the number of entities that you're partnering with.
And I would say anybody who hasn't listened to this episode, I thought the story he told about trying to get some legislation passed. Yeah. It's like the first maybe 15, 20 minutes of the episode is really good.
It was very eye-opening. So I forgot what state was that? Do you remember? It was Colorado or somewhere?
I think it was Colorado.
Yeah, he was trying to get some legislation passed, thought he had it passed, and then ultimately shadowy figures came in at the last second, lobbied at the last second and poo-pooed the legislation, and he got a reality of what politics actually looks like. And it's a dirty game.
I do believe that HR professionals really need to step up and understand that healthcare strategy is as important as a sales plan and operations plan for their organization. And they cannot take a back seat to this any longer because they are fiduciaries of their plan. And, they have to understand this because they can impact so many lives by being better stewards of their healthcare plan.
So you're supposed to save the mic drop for the end of the podcast. So what's interesting is while we were in real time shooting that, I knew that was going to be a clip because you could actually feel the audience and hear applause trying to break out before she even finished her thought, because it was like her mic drop moment, which I obviously joked about. And this was in the middle of the show. I'm like, you're supposed to save that for the end. But it also wasn't surprising to me. Stephanie, I've had her on before. I've shared that she had the most watched podcast in 2024 for us. Yeah. And I'm not surprised that she caused the audience to spontaneously applaud either.
Yeah. And also, this was an awesome live event. So that was just...
So those of you who haven't seen this, please go watch this. We did a live event with Kimberly Carlson, Kristen Rivers, Stephanie Koch, and Rachel Strauss. We did it with a live studio audience of probably 50 or so people. We had a networking event. We had live Q&A.
Booked out a theater.
We booked out a theater. So it was an undertaking, and obviously you and Dustin took on a lot of that undertaking on our behalf, but people flew in for it the second time we've done it. And I'd love to keep driving attendance to those type of things because we want to do that, once a quarter or so. And thank you to obviously the panelists that joined us as well.
And if you ever want to go to a future one of these, reach out.
Yeah. We make them invite only just because we want to make sure we're getting the right folks in the room to network and do business together. But I would love to look forward in the future where we have hundreds of people showing up to one of these events, and it's a real reason to get together and do a podcast.
Absolutely. So let's get into the game for this week. This one I'm calling which has less ingredients. Okay. So part of I feel like a lot of the debate right now in nutrition stuff and the Make America Healthy Again and all that stuff is that there's just a lot of number of ingredients in things, where it's you.
So you're going to show me 2 different food items and I have to guess?
So I think I have 5 rounds.
Okay, this will be fun.
And so like you talked about how like the Chick-fil-A sandwich has 50 something ingredients.
Yeah, so Chick-fil-A don't sue us, but I've heard there's 55 ingredients in the Chick-fil-A chicken sandwich. Yeah.
So starting off first round, this is Spencer was just talking about these cookies before we started filming, entirely unrelated. I told him I would bring it up in the podcast. So which do you think has less ingredients? Also, don't look at my screen because I have the answer.
Yeah, no. So, but don't let me forget to tell you a story about Lenny and Larry's cookies for the audience of the one I shared with you earlier. Okay, so which one has less? Is it fewer or less ingredients? Fewer.
It should be fewer grammatically. Yeah.
Yes. Okay.
Yeah,
I know how smart you are, but I was gonna say I think it's fewer. Okay, so fewer ingredients. This feels like a trick question, so I'm going to say the Oreos have fewer ingredients.
It was a trick question. Oreos have 11 and Lenny and Larry has 19.
19, yeah.
19.
Well, okay, what's interesting? One promoted as a health food, right? One obviously junk food. We all agree Oreos may be junk food. They're trying to sell protein. Hey, you should eat this, this is healthy, but it has almost double the ingredients. It has 10 grams of fiber, I think, per serving, so maybe more than that. Do you have the actual nutrition info?
I don't. I
don't worry about it. Okay. So the story I was going to tell you, because I used to eat these and they're delicious, by the way. And I got my daughter eating them when she was young because I was like, oh, you're going to get your protein. And she's like, I want a cookie. Okay, we'll have a protein cookie. But it would constantly upset her stomach, and not to give too much information, but she would toot a lot. She'd pass gas. So we started calling them the Tootie cookies. So I was like, do you want to have a Tootie cookie? And she's like, yeah, I do. We're like, remember, your tummy is going to feel a little upset. And she's like, it's okay. I want to have a Tootie cookie.
Yeah.
So that's what we called those, that exact chocolate chip as well. They are good, but they also would upset my stomach. So I stopped eating them.
I guess I would rather my kid want to eat those cookies than the Oreos.
If those are the only two options.
Yes.
Yeah, for sure. And the protein, it's all plant-based protein. So it probably doesn't have the full amino acid profile. But that's okay. They're still pretty good. And I guess if you want to eat it as a treat.
You start making it with beef tallow.
Beef tallow. There you go.
All right. Next one. One of these Starbucks Frappuccino things you get at a gas station. It's mocha flavored. I don't know if that changes your opinion of it. But then the Sara Lee Artisanal bread.
I already know it's the bread.
It is the bread.
Yeah, it's the bread.
It is bread.
And I've actually had that bread before. The only reason, I've tried these Frappuccinos, but they have so much sugar, dude. I can't stand them. Everybody should look at their bread ingredients. And don't get me wrong, bread is delicious. I love sourdough. If you look at modern day bread, you cannot pronounce half the ingredients. Yeah. There's so many. There's obviously seed oils and high fructose corn syrup and random chemicals. Bread has an astonishing number of ingredients.
Did you see the video of the guy? He gets like the Walmart great value bread, and he's like rinsing it underwater.
And it's a sponge, right? Yeah.
It's so weird.
Yeah, because we talked about this with Chef Austin Simmons. It's the shelf life component of this. So bread without a lot of preservatives in it would obviously have a short shelf life, which means it molds, means you can't sell it. So a lot of this is predicated on keeping it shelf stable for a long time. And then they add stuff to fluff it up and all these other things that are all appearance and texture based, but they make the bread less healthy as a result.
What bread do you eat? Do you have a bread recommendation?
I don't eat a lot of bread, but if we did, we tend to go with sourdough. There's some enzyme in sourdough that either helps with digestion or slows down the body's insulin response or blood sugar response. But even that, I very rarely eat bread. We did have a lady in our neighborhood making homemade sourdough with very few ingredients, and it was so good.
I love that.
But she makes it once every other month, so we don't get to buy enough of it.
So this one, the McDonald's. So it's a cheeseburger. I wrote down the ingredients if that helps. Not the ingredients within the ingredients, but just so it's hamburger bun, cheese, pickles, ketchup, mustard, onion, and one hamburger patty. Or the Grenade Oreo protein bar.
But it's got low sugar, or so it says.
High protein, low sugar.
Okay, I know you probably didn't set these all up as a trick, but we did just talk about the Chick-fil-A sandwich having 55 ingredients. I'm actually less convinced, so I'm just going to go for fun. The Grenade protein bar has more.
So the Grenade has more ingredients.
Yes. Is that wrong?
Burger does have more ingredients.
Yeah, okay. I figured as much, yeah.
Yeah, I should have reordered them because not all of them are tricks, but whatever. But yes, so the burger, 59 ingredients.
Oh my God.
In that cheeseburger. And
59 ingredients.
That protein bar is 28, which is a lot for a protein bar.
Yeah, but 28, but if you've ever, you were telling me as you were trying to find protein bars for another thing, Dude, every protein bar is like chock full of sugar alcohols and all this crap. Even the quote unquote clean ones are still full of some stuff you don't want to eat. So I think protein bars are glorified candy bars. That's all they literally are. And most of them, and I suspect this one as well, has soy protein as the main protein source, which I try to avoid soy at all costs as well.
So Heinz ketchup versus French's mustard.
Oh, it's easily mustard. It's fewer.
It has fewer? Okay. So yes. Oh, wait, no. It's not true.
It's not. Okay.
Ketchup has fewer. So ketchup has 8, mustard has 9. So very close.
Yeah, and depending on, like, obviously there's other ketchup styles that are trying to be like the healthy version. You know, this is just a standard ketchup. For some reason I was thinking yellow mustard is just the mustard seed, like vinegar, salt. I thought it was very few, but I mean, you know, no calories, I don't think, or very few, if any, calories in mustard. Yeah.
I didn't know that.
Yeah, you should look. Yeah, now I've got to fact check myself. So keep going, but I'm going to fact check myself.
Okay. Well, while Spencer's fact checking that,
I'm still listening.
The next one, this just came back. I saw everybody posting about it on Twitter, but the McDonald's snack wrap, they brought it back.
Oh yeah, I don't know if you ever had those. Yeah.
So we're gonna compare that and the Soylent Cafe Chai ready to drink thing. So snack wrap is just chicken, cheese, lettuce, ranch, and tortilla, by the way.
Okay. All right. So first off, it is a 0-calorie food. Mustard is. Yeah. There's no calories in mustard.
So if you're dieting, go ketchup over mustard.
Yeah.
I go for mustard over ketchup. Yeah.
All right. So fewer ingredients. I'm going to go with Soylent. Has fewer ingredients.
It does have fewer ingredients.
Yeah.
So Soylent has 38 and the snack wrap has 48. Oh. So isn't that crazy? 40, like you'd think Soylent is the most.
Well, do you know the origins of Soylent at all?
Isn't it something I think you told me one time it's like something where some college kids were making or something?
Some guy, I don't remember if it was a college kids or whatever. I remember maybe 15 years ago reading about this idea of Soylent. It was some software programmer or something that literally just wanted to spend all his day programming and didn't really care about food.
Yeah.
So he was trying to engineer like a food that gave him all the macros and all the nutrients he needed so he could just drink Soylent all day. And I get the concept, but I mean, God, I wouldn't imagine Soylent is going to be what you want to base your whole nutrition off of.
Yeah. Well, and it's also weird. I've said this before, maybe on this podcast, but that like they named it Soylent after the movie Soylent Green, which is about a food named Soylent that is made of human flesh. Yeah. Like, why would you name your product that? So I have a Ask Spencer Anything question for you. So if you're listening, the segment where you can ask Spencer anything, obviously, the number is 469-213-6381. So text us or call us and leave a voicemail. Question is, some of my clients are getting a stop loss renewal with huge rate hikes. Any advice on how to start the conversation with them?
So with the employer,
yes.
I guess is what he's saying. Okay, so very common these days. We just talked to Jay Ritchie about it just this morning, and he's the CEO of HCC, for people that don't know, one of the biggest stop loss carriers. A couple things. One, just give them the reality of the state of the market right now. So not just stop loss insurance, the trends in healthcare, like underlying medical trend is projected to be 9 or 10% this year. Jay told us the loss ratios are terrible last year for stop loss carriers based on historical averages. So it's just kind of the reality check is where you start. Then it's digging into the claims. What's driving it? Are some of those avoidable? Is there a story with the stop loss carrier that you can say, here is our plan to fix these things and how? That could be a good collaborative conversation. And then the last thing I would tell the employer is it's probably a good time to look at raising their specific deductible. Could be a very small bump in the spec. Often will have a pretty sizable decrease on the premium. And so the combination of those things is probably where to start. But I think it's always good to be just forthcoming with your employer that this is being driven by these factors. And a lot of it is being driven by their own experience or claims experience alone.
Cool. Well, that's
free consulting advice on the podcast. Yeah.
We should be charging for this segment. Yeah. So yeah, that's the podcast for this month.
Awesome.
I guess we'll regroup about a month and a half, end of August.
Yep, let's do it.
But yeah, thanks, Spencer.
Thanks for listening, guys. And thank you. Please give us a text or a call or an email. I'd love to answer your questions on the show.